Introduction. Center yourself, assess situation, role introduction, identity check, name concern, give information, confirm confidentiality, advise right to decline, recheck understanding, and ensure consent. For initiating a peripheral intravenous infusion, assess patient's experience with IV therapy and arm placement preference. Determine whether the patient is to undergo any planned surgery or is to receive blood infusion later. Assess for risk factors such as presence of heart failure or renal failure or low platelet count. Prepare patient, explain the procedure and purpose. Observe for signs and symptoms including fluid or electrolyte imbalances such as edema, distended neck vein, irregular pulse, and decreased skin turgor.
Tonic solutions are used for fluid volume deficit, loss of GI fluids, plasma, or hemorrhage. Hypertonic solutions are used for temporary treatment for shock, edema, and if plasma expanders aren't available. Hypotonic solutions are used for hypertonic fluid imbalances to dilute extracellular fluid and hydrate cells.
Volume of the solution times drop factor over time in minutes. 500 ml of solution times 10 drop factor over 4 hours, which is 240 minutes, equals 20.8, be rounded off to 21 drops per minute. Gather supplies. Check IV solution using their 8 rates of drug administration. Check solution for color, clarity, and expiration date. After opening the sterile package during sterile aseptic technique, maintain sterility of both ends. Place roller clamp about 2 to 5 cm below the drip chamber and close the roller clamp. Inserting infusion set into the fluid bag. Insert spike into the opening of the IV bag, keeping the spike sterile. Compress drip chamber and release, allowing it to fill 1/3 to 1/2 full. Then remove air bubbles. Infusion pumps move fluid by compressing and milking intravenous tube. Rate control clamp should be open completely while infusion controller or pump is in use. It is important to maintain asepsis of the catheter hub. Before connecting, clean it with alcohol swab. Establish flow rate by counting drops in drip chamber for 1 minute by watch. Then adjust roller clamp to increase or decrease rate of infusion. Assess for any complication. Local complication: infiltration, extravasation, thrombosis, thrombophlebitis, and phlebitis. Systemic complication consist of embolism, hematoma, systemic infection, speed shock, circulatory overload, and allergic reaction. Saline or sodium chloride is used as a sterile solution to flush out and remove any IV medication from your catheter. The purpose of IV therapy is to provide patient with fluid, usually used for patient that is unable to swallow and also unconscious patient. It is used to keep the veins open for administration of drugs or when waiting for blood transfusion. It is used to maintain and correct electrolytes of the body.